Okay, and as you alluded to, implementation of government policies have always been some kind of challenge in Nigeria. How do you think this can be overcome, especially in this case?
It is very important if we're going to get value from this very important act that government appoints only competent and skilled persons to head the various levels, the various templates that will drive the various provisions of the Act in its totality. And that was why I talked about a competitive selection process. This is not a law that says it is only members of one profession or that you must be a professor. No, you don't need to be a professor before you can be an achiever. In any case, most of these are jobs where you need to bring in your skills as an administrator and a manager of cognate experience. So it's not about the professorial thing, academic degrees. It is about experience in practice as a care provisioning, experience in administration and managerial responsibilities.
Okay, as we wind down, a woman selling pepper, a trader, the person or she may have heard about the National Health Act becoming law, and she's thinking, how does this affect me? What would you tell her?
You remember I talked about social health insurance, NHIS. If it is very well driven, health insurance still remains one of the best modes of healthcare funding. Now, we have reached the level where if the promoters or the drivers of the NHIS are getting it right, community-based social health insurance should be the watchword now, CBSHIP. Now, and that's where the market women and all the other people, especially in the informal sector, which is largely unregulated, this is where they come in. Government must get its acts right through the NHIS by coming up with what I have always styled a loose tripartite structure that would embody or encompass the mutual health associations through CDAs, community-based community development associations in the grassroots, government on the other hand, and then the HMOs. The HMOs will continue to handle monitoring and evaluation, which is their core area of competence. Government, be it federal, state, local government, is strong in the area of advocacy because we want to harness the strength of each of these three legs. And then, of course, the CDAs, or if you're talking of Okada drivers or market women, you cannot get them to key into health insurance if you do not utilize the executive committee or whatever structure that epitomizes their leadership. And that's what I mean by the mutual health associations. So we need to get them to key into that vision directly by engaging them. Rules of engagement, the best tenets of rules of engagement. And I think this is where the authorities at NHIS must start, so that all the funds dedicated to essential drugs in this act will not be just another waste down the drain.
Talking about the Johesu strike, you had a meeting, that is Johesu and the federal government team, on Monday, December 15. What was the outcome of that meeting?
All that happened was the representatives of government came up with information. Oh, we have now computed figures, what it will cost to pay other health workers in view of salary adjustments. That figure was not given to anybody. The enabling circular was not shown anybody. So there's no guarantee that anything with respect to payment will be in the 2015 budget. And this is not how to handle negotiations, high-level negotiations of this nature. And these negotiations are supposed to be at presidential level. That was why it was the Secretary to Government of the Federation, Senator Ayim Pius Ayim, who chaired the various sessions where USO met the federal government from January to August and in November. But all of a sudden, these things are deteriorating, and because what I see now is they're trying to take it back to ministerial level, and that's why it's not working. You can imagine that it's about 1 month. Government has not been able to come up with only just, I mean, there are 12 major areas of demand. Government has not redressed even one.
But what about the consultancy status?
Consultancy status has no, it's just propagandist. What you see, what they tell you is propagandist. It's not been dealt with because it's not been inculcated into the scheme of service of the other healthcare professionals. There is no circular that authorizes payment of specialist allowances for health workers. So you can't say it's been dealt with. They have not done anything. That's the truth.
So Nigerians will have to continue to bear this brunt.
Unfortunately so. Oh yes, unfortunately. Because we need to solve this matter once and for all. We can't continue with this vicious cycle.
How does this make you feel?
Very bad, horrible. Against the background that any of us can be patient anytime. I was a patient somewhere in the last 24 hours. An emergency situation. I had some very serious pain. Something I haven't had in about 20 years. I almost could not walk. And this was about 12 midnight. I couldn't attend to myself. So I had to reach out to one of my colleague pharmacist friends to supply the medicines through his community pharmacy. But you know, the truth is not everybody would have somebody to reach out to at that unholy hour of the day. So it makes me feel very bad against the background that emergencies would arise and all that.
There's nothing you can do about it if you have the powers.
Oh, well, there's nothing I can do in the immediate, but because the ball is squarely in the court of government. That's the truth.
Thank you so much for your time. It's the end of the year and time to wine, dine, and say thank you to those who have touched you in one way or the other. One of such avenues was created recently by the Sickle Cell Foundation of Nigeria, a not-for-profit making organization with a vision to alleviate the burden of sickle cell disorders in Nigeria. Friends of the foundation were treated to a luncheon, and the management of the organization used the occasion to talk more about what the National Sickle Cell Center is into and the need for more funding for its activities.
We have laboratories that are sepsis second to none, both regular hemoglobin laboratory and we have a DNA laboratory, which is associated with prenatal diagnosis. That is diagnosis of sickle cell in your unborn child, but in early pregnancy. And this is, of course, something that into conjunction with our genetic counselors. We counsel them before they go up for that procedure, but it makes a difference in their lives. We don't dictate to them what they do subsequently, but the essence is they know very early on in pregnancy what the child has.
The sickle cell centers, USA has 25, Nigeria has 3. But of those 3 sickle cell centers, this is the only one that's really functioning well. Luth has trained 2 doctors and 2 nurses in Rome. But we cannot have the transplant started because the building that they're building for the pediatric, the funds are so slow from the federal government. And in Rome, they can't understand. So we need funding for that. We fund the bone marrow transplant unit and then research projects. For example, the pain they have, why do they have the pain? You know, we still don't know. And that's why all we can give are painkillers and analgesics until the pain stops. we need, but if we do research, I'm sure we can get you.
Some of the guests at the event include the Doyen of Accounting in Nigeria, Mr. Akintola Williams, the former military governor of Lagos State, retired Brigadier General Mobolaji Johnson, and an associate professor and consultant endocrinologist with the Lagos University Teaching Hospital, Dr. Femi Fasomade, among others. Moving on to another part of Africa, Liberia has begun treating Ebola patients with serum therapy, a treatment made from the blood of recovered survivors. Doctors hope the experimental treatment could help combat the virus that has mostly affected 3 countries in West Africa. If a person has successfully fought off the infection, it means their body has learned how to combat the virus, and they will have antibodies in their blood that can attack Ebola. Doctors can then take a sample of their blood and turn it into serum by removing the red blood cells, but keeping the important antibodies, which can be used to treat other patients. Doctors in Liberia will monitor how safe and effective the serum treatments being given at the Elwa Hospital in Monrovia is. A number of Liberian healthcare workers have been trained to give the therapy. The US, UK, and Canada are testing different kinds of vaccines in controlled clinical trials. The aim is to have 20,000 doses that could be used in West Africa by early next year. Meanwhile, the clinical trial of an Ebola vaccine in Switzerland has been interrupted after some patients complained of joint pains in their hands and feet. Authorities at the University of Geneva Hospital said the trial was stopped 1 week early in all 59 volunteers as a measure of precaution. There is currently no vaccine licensed for use to protect against Ebola. 2 vaccines are currently being tested in humans in a number of countries. The side effects in the Geneva trial were experienced by 4 volunteers. The hospital said human safety trials would resume on the 5th of January 2015 in up to 15 volunteers after checks had taken place to ensure the joint pain symptoms were benign and temporary. Finally, in Sierra Leone, Ebola containment efforts are continuing as health authorities in the country mount house-to-house searches in the capital Freetown to find hidden cases of Ebola. Also, Sunday trading will be banned and travel between districts restricted. The measures come after the authorities banned all public celebrations of Christmas and New Year in a bid to tackle the virus. Sierra Leone is one of the countries worst hit by Ebola, which has killed thousands of people this year. In a statement, President Ernest Bai Koroma said the search is aimed to break the chain of transmission.
I know that this is the festive season where Sierra Leoneans often celebrate with families in a flamboyant and joyous manner. But all must be reminded that our country is at war with a vicious enemy.
In addition to the blanket Sunday trading ban, the new measures will include time restrictions on Saturday and weekday shopping. Freetown has recorded more than 50% of all Ebola infections in Sierra Leone over the past weeks. That's health news for this week. Don't forget to do everything in moderation this season and even beyond. I am Yomi Otaibe, wishing you a Merry Christmas.